The camera caught it first. Nobody believed what it showed until the doctor explained it. They thought the golden retriever was begging for food. They almost missed what he was actually doing. If you had walked into that kitchen at mealtime, you would have seen the same thing Craig and Melissa saw. A large golden retriever positioned beside their daughter's high chair, with his face level with the tray, watching the baby eat with an interest that looked, in every obvious way, like a dog hoping for dropped crackers. Bentley had always been a counter-surfer, a food-motivated dog in the way that most Goldens are food-motivated, enthusiastically and without embarrassment. The behavior at the high chair seemed consistent. It seemed explainable. It seemed like Bentley being Bentley. It was not Bentley being Bentley. Ellie was 9 months old, round-faced, vigorous, eating pureed sweet potato and pea mash with the commitment of a child who has recently discovered that food is one of life's genuine pleasures. She was hitting every milestone on schedule. Craig was an IT systems manager and Melissa was a dental hygienist, and between the two of them they had read enough parenting literature to know what to look for and when to worry. They were not worried. The behavior change in Bentley started so gradually that neither of them could name an exact date. It was a Tuesday somewhere in the 4th week of Ellie's 9th month that Craig noticed Bentley wasn't watching the tray. He was watching Ellie's face. His muzzle was level with the tray, but his eyes were tracking upward, to the baby's eyes, to her mouth, to the small sounds she made between bites. He was not waiting for dropped food. He was reading something. Melissa saw it 2 days later and said it out loud. "He's not looking at the food." Craig agreed. They didn't know what to do with that observation, so they filed it and moved on. If you stay for stories about what animals sense before we do, you are in the right place. Subscribe so you do not miss the next one. The high chair footage was accidental. Melissa had set up the family camera at the kitchen table to record Ellie trying new foods. One of those parenting video projects that starts with intention and sometimes captures something unexpected. She uploaded the footage on a Thursday evening. She was looking for a clip of Ellie's expression the first time she tried mango. She found Bentley instead. In the footage, approximately 7 minutes in, Ellie begins fussing mid-meal. It's a normal fuss, the kind that precedes dropping a spoon or needing a position change. Bentley, who has been beside the high chair the entire time, lifts his head and his ears come forward, and he presses his nose slowly toward the space in front of Ellie's face, and holds it there for 14 seconds. Then he turns his head and looks directly at the camera, not at Melissa behind the camera, at the lens itself, and holds that for 3 seconds. Then back to Ellie's face. Melissa watched that segment 4 times. She called her sister, who was a nurse, and described what she had seen on the video. Her sister asked how long Ellie had had the fussiness during meals and whether she was gaining weight at her normal pace. Melissa said the fussiness had been increasing for about 3 weeks. She hadn't thought about the weight. She looked at the baby book. The home scale check she did the previous Sunday showed Ellie was slightly below the tracking curve. She had noted it as normal variation. Her sister said, "Call the pediatrician. Has your dog ever done something that made no sense until it was the only thing that made sense? Tell us in the comments. These stories deserve to be heard." Dr. Yolanda Barnes, 9 years in pediatric practice, examined Ellie on Friday morning. She ordered blood work. The results came back Saturday. She called Melissa at 9:17 a.m. and asked her to come in on Monday. She used the word findings, which is the word pediatricians use when they are buying time to deliver information in person. Ellie had a zinc and iron deficiency that had been building for several weeks, creating a subclinical malabsorption pattern that would have self-resolved on intervention, but could, without it, have affected her neural development in the window they were currently in. The dietary correction protocol was simple, direct, and completely effective. Dr. Barnes told them they had caught it at the right time. She asked what had prompted the visit. Melissa held up her phone with the kitchen footage playing and said, "The dog?" Dr. Barnes watched the 14 seconds of footage with Bentley's nose near Ellie's face. She asked if the dog always did this near the baby. Melissa said no, only in the last few weeks, only at mealtimes. The doctor was quiet for a moment. Then she said that malabsorption and micronutrient deficiency alter the chemistry of a person's breath and skin in ways that are measurable by mass spectrometry. Dogs have been documented to detect analogous chemical changes in patients before clinical symptoms appear. She looked at the phone screen. He probably started noticing something had changed in the way she smelled, she said, and he kept coming back to check. Every guardian deserves to be recognized, even the ones who never asked for anything in return. If stories like this matter to you, subscribe so you never miss the next one. Ellie has been on the supplementation protocol for 6 weeks. Her weight tracking is normalized. Her fussiness at mealtimes resolved within 10 days of beginning the protocol. Dr. Barnes described the outcome at the 6-week follow-up appointment as exactly what we hoped for. Bentley has stopped positioning himself at the high chair. He still comes to the kitchen at mealtimes and lies down a few feet away on the mat near the back door. He is not watching Ellie's face anymore. He watches her the way he watched her before all of this started, from a comfortable distance, relaxed, occasionally hoping for a dropped cracker. Bentley being Bentley. Melissa watches him at those moments and thinks about the 14 seconds of footage she almost scrolled past. The next story on this channel involves a husky who began waking his family at the same time every morning, 3 weeks before anyone understood that the time mattered.